The purpose of this video will be to demonstrate skill number 2, applies one knee-high elastic stocking. This skill requires you to maintain competence on both a mannequin and a human. This video we will show how to perform the skill on a mannequin. Steps 1 through 3 cover your introductory speech. The introductory speech will be introduced to you in the introductory video. Step 1. Address the client by name and introduce yourself to client by name. Step 2. Explains procedure, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. Step 3. Privacy is provided with a curtain, screen, or door.
Knock, knock, knock. Hi, Mrs. Jones. My name is Mark. I'll be your student nurse aide today. Today we're going to be using an elastic TED hose and applying that. Make sure that the bed is in a low and lock position. You're going to make sure that you touch the brake with your foot. Bump against the bed to make sure it's not going to move. I can visualize the bed is in a low position. Call lights within reach. Provide privacy. And wash my hands.
Step 5. Turns the stocking inside out, at least to the heel.
Right, I'm going to take the stocking. I'm going to face the heel towards me. This is a rectangle portion about 3/4 the way down the TED hose. We're going to roll the TED hose up in our hand, working our way down, getting to the middle of that heel. You're going to pinch with your pointing finger and your thumb in the middle of that heel, flip it inside out. You're going to pinch at that point and continuing flipping the rest of the TED hose inside out.
Step 6. Places the foot of the stocking over the toes, foot, and heel.
All right, Mrs. Jones, I'm just going to expose your leg here, making sure I don't overexpose my patient. Verifying where the heel is. Going to stretch out the TED hose at this point, and I'm going to place it over the patient's foot. Working all the way up, and then taking that TED hose and wrapping it around that heel. I want to make sure that I'm not using excessive force during this time or bending the leg. If you're having issues, if you have a mannequin, your instructor or the state surveyor can hold the patient's leg for you.
The stocking must be over the heels, toes, and foot before moving on to step number 7. If you move on to step number 7 without the stocking over the heels, toes, and foot, then you have failed step number 6.
I'm going to verify. Yep, the heel is covered and the toes.
Step number 7. Pulls the top of the stocking over the foot, heel, and the leg.
So now we're just going to flip that TED hose right side out. Getting over the heel, making sure I don't use excessive force, and I'm going to pull that TED hose all the way up.
Step 8. Moves the foot and leg gently and naturally, again avoiding force and overextension of the limb and joints. Step 9. Finishes the procedure with no twists or wrinkles, and heel of the stocking, if present, is over the heel and opening. And the toe area, if present, is either over the heel, over the toe. If using a mannequin, the candidate may state that the stocking needs to be wrinkle-free.
All right, so I'm going to check and make sure that my heel is actually in the correct position, making sure that the toes are not uncovered, that the TED hose are pulled back. There's no wrinkles. I'm going to take my hands, I'm going to rub up the TED hose to feel for any wrinkles. And there's not.
Step number 10. Signaling device is within reach and bed is in low position.
This time I'll do my exit speech, so make sure I cover up my patient. Once again, checking to make sure that that bed is still in a low and lock position, that the call light is within reach. Pull back the privacy curtain. Wash my hands, and skill complete.